So it's the cold season again. And as usual, you develop your nasal congestion, your sore throat, you cough. And you think, is it the common cold? Is it a head cold? Or could it be something more ominous? In this video, we'll examine exactly this question. Stick around. People who develop upper respiratory infections with symptoms such as runny nose, nasal congestion, sore throat, and cough often self-diagnose themselves as having the common cold or a head cold. Now, the word common cold originates from the age-old belief that chilling the body leads to a lowering of the body's resistance and hence to upper airway infections and common colds. But the common cold is not a single disease. Rather, it is a syndrome of symptoms that are caused by a variety of respiratory viruses. Viruses such as rhinoviruses and adenoviruses and coronaviruses and influenza viruses and parainfluenza viruses. Common cold symptoms might even be caused by bacterial infections at times. Scientists now know that these respiratory viruses that cause the mild symptoms of cold can also cause deeper infections in the lung, causing serious disease. The diseases that are caused by respiratory viruses can range from asymptomatic, in which the person is not even aware that they're infected, to severe diseases infecting the tissue of the lung. A good example of the spectrum of disease caused by these viruses is RSV, or respiratory syncytial virus, which in young adults can produce a cold syndrome, mild symptoms, runny nose, sneezing, cough, sore throat. Whereas in young patients, children under the age of 5, and in elderly patients, it can lead to bronchiolitis and pneumonias, which can be fatal at times. Infections with respiratory viruses, therefore, span a large variety of diseases that can be localized to the upper airways, such as the common cold, or diseases that can infect the tissue of the lung, deep inside the lung. And these infections in the lung are what we call pneumonia. Lung infections by viruses or viral pneumonia are generally milder than infections caused by bacteria. And people can continue doing their daily activities without interruption. And often these infections will resolve on their own without treatment. This is what is known as a walking pneumonia, precisely because patients are able to continue doing their activities, their daily activities, uninterrupted. These walking pneumonias, mild pneumonias, can also be caused by what are known as atypical bacteria. These are bacteria that we are unable to culture in regular culture mediums in the laboratory, and that do not respond to the penicillin-based antibiotics that we usually use to treat common pneumonia. Atypical bacteria include the mycoplasmas and the chlamydias and the coxiellus. And these, when they do cause a pneumonia, will often cause these walking pneumonias or mild pneumonias. One of the biggest differences between the common cold and a walking pneumonia is the presence of constitutional symptoms such as chills and fever and fatigue, which tend to be less pronounced in the common cold. But patients with the common cold, as well as patients with infections by these respiratory viruses, can have similar symptoms of upper airway congestion and sneezing and cough and a sore throat, making it difficult to differentiate between the two. The common cold also tends to produce phlegm, whereas atypical pneumonias are generally accompanied by a dry cough or a cough that produces scanty phlegm at the most. The overlap in symptoms between these conditions may be so profound that it is impossible to tell the difference between a severe cold, a serious cold, and a mild case of influenza. In difficult cases, only a doctor would be able to tell you whether what you have is a common cold or a walking pneumonia by examining your lung and by sending you for a chest x-ray. I hope you found the video useful. If you did, like and share the video with your friends and family. We appreciate your support. You can support the channel by subscribing. Until the next video, stay healthy and stay safe.